Every 2 seconds, someone in the United States needs blood. A car accident victim in Phoenix, a premature infant in Chicago, a cancer patient in New York. They do not know each other. They will never meet. But they are all connected by the same invisible infrastructure. The American blood supply chain. The United States requires approximately 29,000 units of red blood cells every single day. 13.6 million units of whole blood are donated each year, collected, tested, processed, stored, and delivered, across a country of 330 million people, across 50 states, across more than 6,000 hospitals. And it has to be right, every time. This is not a government program. It is not a single organization. It is a network, a coordinated system of blood collection centers, testing laboratories, processing facilities, distribution hubs, and hospital blood banks, all operating in parallel, all connected, all running continuously. And at the center of this network are the blood collection organizations. The American Red Cross alone supplies approximately 40% of the nation's blood. The remaining 60% comes from independent blood centers, regional organizations operating across specific geographic areas. Together, they manage a national donor base of millions of Americans who give blood voluntarily, without compensation, on a recurring schedule. The system depends entirely on that voluntary act. There is no backup if donors stop coming. When a donor arrives at a collection center, the process begins immediately. A health screening is conducted first. Blood pressure, pulse, temperature, hemoglobin level, a detailed health history questionnaire. Only donors who meet all criteria proceed to donation. A standard whole blood donation takes approximately 8 to 10 minutes. One donation, roughly 1 pint, can save up to 3 lives. But the donation is only the beginning. Every unit of blood collected in the United States must pass through a series of mandatory laboratory tests before it can enter the supply chain. These tests screen for infectious diseases including HIV, hepatitis B, hepatitis C, West Nile virus, and several others. The testing process is federally regulated by the Food and Drug Administration. No unit of blood enters the supply chain without passing every required test. Every single unit. After testing, whole blood is rarely used as collected. It is separated. Processing facilities use centrifugation, a high-speed spinning process, to divide each unit into its components. Red blood cells, platelets, plasma. Each component has a different medical use. Each component has a different shelf life, and each component requires different storage conditions. Red blood cells can be stored for up to 42 days at precisely controlled refrigeration temperatures between 1 and 6 degrees Celsius. Platelets are far more fragile. They expire in just 5 to 7 days and must be kept at room temperature with continuous gentle agitation, a specialized storage system that keeps the platelets viable but requires constant mechanical movement. Or plasma can be frozen and stored for up to 1 year. These are not guidelines. They are hard biological limits. The clock starts the moment a donation is collected. This is where the logistics operation becomes critical. Blood products must move through the supply chain fast enough to reach hospitals while still within their usable window, but not so fast that they arrive before storage capacity exists to hold them. The distribution network operates on a system of regional blood centers that function as supply hubs. Each hub monitors inventory levels at surrounding hospitals in real time. When a hospital's stock of a particular blood type drops below a defined threshold, a resupply order is triggered automatically. Delivery routes are pre-planned. Refrigerated transport vehicles maintain precise temperature control throughout transit, and for critical shortages, air transport is used. Inside a hospital, blood products are managed by the blood bank. The hospital blood bank is a specialized laboratory, typically operating 24 hours a day, 7 days a week, responsible for receiving, storing, testing, and issuing blood products to clinical teams. When a physician orders blood for a patient, The blood bank does not simply pull a unit off the shelf. It runs a compatibility test. A sample of the patient's blood is tested against the donor unit to confirm compatibility before transfusion. This cross-match process typically takes 45 minutes to 1 hour. But in trauma situations, where a patient is losing blood faster than compatibility testing can be completed, the blood bank maintains a separate inventory of emergency release blood. Type O negative, the universal donor type, compatible with any patient, available immediately, no testing required. Managing a hospital blood bank is not simply a matter of keeping enough supply on hand. It is a continuous balancing act between two risks. The first risk is shortage, not having enough blood of the right type when a patient needs it. The second risk is wastage, holding too much inventory and watching units expire before they can be used. Every expired unit of blood represents a donation that saved no one. Blood bank managers use demand forecasting to navigate this balance. They analyze historical transfusion patterns at their facility. They track scheduled surgeries that will require blood products. They monitor regional emergency department activity that might signal increased trauma volume. And they maintain direct communication with their regional blood center, adjusting orders daily based on anticipated need. The system is tested hardest during mass casualty events. A major traffic accident, a natural disaster, a large-scale trauma event. In these situations, the regional blood supply network activates a surge protocol. Blood centers increase collection capacity by opening emergency donation drives. Regional hubs redirect inventory from lower demand areas toward the affected region. Hospitals receiving mass casualty patients receive priority resupply. The response is coordinated, it is pre-planned, and it activates within hours. But the most persistent challenge facing the American blood supply chain is not a single catastrophic event. It is the chronic daily pressure of maintaining supply against a demand that never stops. Blood cannot be manufactured. It cannot be stockpiled indefinitely. It expires, and the only source is human donors who choose to give. The national blood supply operates with a target inventory of approximately 3 days of supply at any given time. Not 3 weeks, not 3 months, 3 days. That margin is not a failure of planning. It is the biological reality of a product that cannot be stored for long and must be replenished continuously. Seasonal shortages are a recurring challenge. Summer and winter holidays consistently produce donor shortfalls as donors travel, change routines, and temporarily step away from donation schedules. At the same time, hospital demand continues unchanged. Blood centers address these predictable shortfalls with targeted recruitment campaigns, reaching out to lapsed donors, activating community blood drives, and mobilizing mobile collection units to reach donor populations outside permanent collection centers. The technology infrastructure supporting this operation has evolved significantly over the past 2 decades. National blood management software systems now allow real-time visibility into inventory levels across entire regional networks. A blood center in Atlanta can see that a hospital in Savannah is running low on type AB plasma, and initiate a transfer before the hospital even places an order. Electronic tracking follows each unit of blood from the moment of donation through testing, processing, storage, distribution, and transfusion. And every unit has a barcode. Every scan is recorded. Every location is logged. If a safety concern arises with a donated unit after it enters the supply chain, the tracking system can locate it within minutes. What keeps this system running is not one organization. It is not one technology. It is not one protocol. It is the coordinated operation of thousands of collection centers, laboratories, distribution hubs, and hospital blood banks, each managing their piece of the chain, each communicating with the others, each holding to the same standards and timelines. And behind all of it, the donors. 6.8 million Americans who give blood each year, voluntarily, repeatedly, without payment. Without them, none of the rest exists. Every 2 seconds, someone in the United States needs blood. And every 2 seconds, the system delivers. Not because of luck, not because of chance, because of infrastructure.
Dave.
There is a subscribe button below this video. It is a small action, but it helps document the systems that quietly keep millions of people alive. If you are curious about how American healthcare operates behind the scenes, the dispatch networks, the organ logistics, the emergency protocols, the supply chains, consider subscribing. And tell us in the comments, have you ever donated blood? Do you know what blood type you are?